My name is Heather, and I'm a family nurse practitioner, and I'm a specialist with the Department of State, and I'm a medical provider. My husband does international development work. We were met as Peace Corps volunteers, and so we were looking to go overseas and work internationally again. 2 months after I arrived, they evacuated families out because of Ebola. Now, it wasn't necessarily because we were afraid of getting Ebola. We had really good science, we had really good information and facts on how to prevent Ebola. The risk to embassy community was very low, but all of the medical resources, there is very little medical resources available in Sierra Leone to begin with, but they all left because of the Ebola crisis. Their hospitals couldn't handle having just one Ebola patient would close them down. A lot of the medical providers have the means to be able to leave, and a lot of them did leave. With that, if there was a period of time that if someone got critically ill, let's say like appendicitis, we had no surgeon in the country to be able to treat the person. Air ambulances started to refuse coming to the region because they were afraid of having to transport an Ebola patient. And the hospitals that we wanted to transport the patients to in London, well, in Europe usually, were refusing patients from the region. So we made the decision to evacuate families out, non-working family members, to decrease our footprint in the country of people who could get sick. So that meant that my husband and my son, who had just turned 1 year old, were evacuated out. So it was both professional and personal. It was hard. I was part of the decision to evacuate patients or families out, but it was the right decision at the time. The work during that period of time was very interesting. I mean, I have a background in public health along with as a nurse practitioner, and to be thrown into this crisis, it was a lot of work. It was really hard work and challenging, but it was really interesting. I got to work with some amazing people. If I want to, or if I need to spend extra time with a patient to provide education, I can. And so you do everything in this job. I used to say I get bored pretty easily. I was always looking for different projects to do, and I've never been bored a single day in this job. Between clinical practice, but also we run the health unit. So you're the nurse, you're the manager, you're the nurse manager, you're the medical director, you're the administrative director. You run every aspect of that health unit. And the patient population itself is smaller, but you're really busy between the administrative tasks, but also the clinical care and the patients coming in. And I thought I would be bored, and I have not been bored yet.